Let's talk about plantar fasciitis. What is that? You hear about it all the time.
Right, it's very, very common. It's heel pain. It can be in the center of the heel, it can be around the sides of the heel. A lot of people come to me with pain on the outside of the foot where they've actually been walking toward the outside of the foot. It's an irritation or inflammation of a soft tissue band that starts in the heel, goes all the way out the arch into the toes.
So why is the foot not painful in the bottom of the foot? Why is it the heel? Because if it goes all the way down the bottom of the foot, the fascia.
It can be all the way out the bottom. So some people have arch pain and some people have just localized stone bruise pain. The misconception is that it's because of a heel spur. It is not because of the heel spur. It is this soft tissue band. So it doesn't require an operation. It takes 1 to 2 years typically to get over it.
The foot is your best friend, very slow to heal. Now, what do you do for it to get over plantar fasciitis?
You wear the proper shoes,
and
shoes
what kind
that
of
have
shoes?
thick, firm padding, a roll bar type of shoe, an athletic type shoe. If you're going to wear a sandal, not a flat shoe, and a shoe needs to have supportive arch and not too flexible. You're going to stretch, pull the foot up, stretch, put the foot behind you like a lunge, stretch with the heel on the ground. And I tell women, stretching at the grocery store, if you're on the phone, stand up, talk on the phone, put your foot back and stretch.
What if you wear those high-heeled shoes? That's bad?
Well, heel is better than a flat, but more like a 1 to 1.5 inch heel as opposed to a 3 or 4 inch heel.
Now, you want to stretch sort of the front and the back, so you want to stretch that in between fascia that's there.
And the Achilles tendon, because the Achilles tendon gets tight as well. So you may feel the stretch in the back of the leg, but that is also stretching that plantar fascia.
So the Achilles tendon is where?
It starts in the calf, the muscles, and then they come down and attach to the back of the heel. So it all is interrelated.
So you got problems down to the heel and then from the heel on forward, and stretching and time and proper shoes. Medications?
Anti-inflammatories can help, and also ice. You can take a plastic water bottle, put it in the freezer, refrigerator, roll it on your foot like an ice massage. No, it won't tickle. It would feel good. And then a night splint, which holds the foot on stretch all night long and keeps that plantar fascia stretched out.
What's most important? The ice massaging, I guess it is?
The stretching and the shoes are the most important.
Any special brand of shoes that?
New Balance or Brooks makes a roll bar shoe, and there's another shoe out. It's expensive, but it's very effective, called MBT. And it has a really thick rocker sole, but it helps unload the heel and the arch.
So do most shoe stores carry these type of shoes, or do you have to go to a professional orthopedic shoe store?
No, they even carry them at Dillard's, Coffins,
so
Foot
any large
Solutions,
department
Walking
store.
Walking Company, all those
Are they familiar with, a person comes in and says, my doctor says I've got plantar fasciitis, what kind of shoes can you show me? They pretty
A lot
educated?
of them can be familiar with that because I've seen a lot of patients at those stores, so they probably are familiar by now.